Hey friends, this is Dr. Ginger Pillitteri with SpEdadvisors.com. Were you aware that 20 to 50% of children have some type of feeding disorder or feeding problem? And that number jumps to 70 to 89% when the child has some type of special needs. Whether your child is a picky eater, has a food aversion, or just simply you just don't know what to do during meal times, I want to encourage you to reach out and see a feeding therapist. One speech therapist in Arizona is making a world of difference, and her name is Adriana Salazar. She is a trained feeding therapist and owns her own company called Food is Fun Therapy. So we're going to find out what she has to say about feeding therapy. So Adriana, thank you for joining us today. And we have a lot to cover regarding food therapy because it's a really big, hot topic out there. And of course, the first question is, tell me what it is. What is feeding therapy?
That is a great question. Feeding therapy is teaching your child, no matter what age, how to eat. And the first thing we determine in feeding therapy is what is the cause. So that's our number one goal. What's going on? Is it an oral motor issue where the mouth isn't moving the right way? Is it a sensory issue where they have problems with texture or smell? Or is there something going on with their digestive system? So in feeding therapy, we do an evaluation, look for the root cause, and then we go from there and figure out the best way to get your child eating.
Okay, so then tell me who benefits. You just kind of hit into that of the who. Tell me further on maybe someone that you've worked with recently of who could benefit from this feeding therapy.
Well, anywhere from infants to teenagers I've worked with. So a baby will stop eating by 3 days of age after they're born if food is painful for them. So they benefit from it. The biggest benefit I see with my expertise is picky eaters. Okay. So it's the parents that come in and they say, my kid will only eat French fries and only eat chicken nuggets from McDonald's and won't eat pizza with sauce on it. And they're stressed out trying to feed their kids some healthy food. So that's who I think I see the most progress with.
Awesome. Okay, that makes sense. And, like you and I have talked previously, even my own children, could benefit from something like this. So basically, feeding therapy is not just kids with special needs, it's any type of individual that struggles with any sort of struggles with textures, smells, anything regarding food in general, correct? Yep. Okay.
Yes.
Okay, so now lead me into a typical feeding therapy session with one of your learners.
Okay, so let's take maybe because it's so broad and we might, babies were working on something very different than a 5-year-old.
Okay.
So I'm just going to take a 5-year-old picky eater. And what we do is I try to take some of the pressure and the stress away from them. So we're going to make this fun. We're going to make it successful. Okay. We're going to start with something. If they like chicken nuggets is really something I work with a lot. So if they like chicken nuggets, we're going to take McDonald's chicken nuggets and we're going to change it to maybe Chick-fil-A chicken nuggets. Okay. And we're just going to start stretching it and we're going to interact with it in a positive way. So maybe the first session, we're only touching it, talking about how it looks different, how it smells different. And then if the child feels comfortable, we might move it somewhere near their mouth. Maybe we give it a little kiss. And if that's successful, we can lick it. And if that's okay and there's not a really bad reaction, then we might take a little taste of it. And it's really slow baby steps. So that way the kids can learn to trust food again.
Well, and that's what I was going to ask you, how, that time commitment, I know it could vary from each child, but what would you say on average? Do you have an average of what that initial step is to maybe taking the bite? What would be that process?
Well, to taking a bite, I would say the first or second session.
Oh, okay. All right.
Yeah, definitely. Because one of the other techniques that I use is called an all done bowl.
Mhm.
So if they take a bite and they don't want to chew and swallow it, we spit it into a bowl that we have labeled our all done bowl. And
Okay.
once it goes into that bowl, it does not come out.
Okay.
So
Gotcha.
we might take that first bite that first session. We
Mhm.
might chew and swallow it. We might not. But I'd
So,
say within the
go ahead.
first couple times of meeting them, they usually take a bite of the food.
So I have to say, so that all done bowl is kind of like a safety net for the kids. So they know that that piece is not going back into their mouth.
Yep.
Okay.
Yeah, exactly. So it
Gotcha.
takes some of the stress away. I'm not going to force them to eat
Okay.
anything. You have a way to get out of it if you need it. But we're all this whole time that we're doing it, we're probably playing games
Okay.
because we want some distraction. We want it to be happy. We
Mhm.
want them to be having fun. We just want food in general to be a positive experience.
Okay, that's awesome. I love that. I like the bowl idea too, the safety bowl.
Yes,
What
that's
do you call it? The all done bowl?
all done
All
well.
done bowl. Okay, that's a
Yeah.
great tip for parents. Okay, so let me ask you. So for a parent that maybe has never even thought about feeding therapy, how would they know, like what is their how would they know to even contact a feeding therapist? How do they know that there's a problem with their child that would elude them to want to make a call to someone to help?
Okay. That's a great question too. I would say to trust your gut, no pun intended.
Yes.
Um, and if you think there is an issue, I would contact a feeding therapist. When kids are under 4, well, let's say even younger, like say under 2 years old, if they go a few months where they're not gaining weight, that
Mhm.
is like an adult losing weight. So kids should be gaining weight those first couple years of life. So if they're not, then we know there's an issue with food intake, and we want to get them into a feeding therapist. My other recommendation is if you can't go to a restaurant, if you can't go on vacation and find something for your child to eat, you need to get into a feeding therapist.
Okay, that's great advice. Thank you for that. Now, let me ask you this. In doing some research on feeding therapy, I've seen where occupational therapists do it or speech therapists. How would a parent know who to call or even who to recommend to other people?
So you have to start. It goes back to the initial evaluation. Do we think it is a problem here in the mouth? Can they not chew? Are they gagging? Are they choking?
Hmm.
Um, are they vomiting a lot? So
Okay.
then you would start with a speech therapist. If you know it's the smell, really, they can't tolerate it. They
Hmm.
can't touch it. They can't look at it. That's going to be more sensory related. So an occupational therapist is beneficial there. But the best situation is that you get them both.
Okay.
So I work very closely with occupational therapists, and so much so that I've learned so much from them because you really can't do feeding therapy without knowledge
Hmm.
of both things, of the oral motor and the sensory aspect.
Okay, that makes sense. Thank you. All right, awesome. Now, let me ask you then. Let's say a parent sets up a session, they contact a feeding therapist. What do they need to do to prepare for that initial meeting?
The
What should
best
they do?
Yeah, the best thing they could do is to do a food diary. Give me 3 days of what a typical day looks like. What did they eat? What time did they eat it? How much did they eat it? If you can give me a 3-day snapshot, that's perfect. If that's too complicated, a list of preferred and non-preferred foods is very helpful as well.
Now, to explain to parents, explain what preferred and non-preferred is, just in case there's someone that doesn't know what that means.
So preferred is food, their go-to food. They're always going to eat mac and cheese. Their
Okay.
non-preferred is they're never going to eat eggs or avocado. Whatever they refuse, that's an absolute no-go. That goes on the non-preferred list.
Okay. Awesome. Thank you. And then, lastly, just wanted to kind of give some tips to parents out there. What would be something if a parent was not able at this time to contact a feeding therapist? What is something that they could try at home right now, or even during this time when we're all in quarantine and we're not able to go out? What is something that they could try at home?
The biggest thing is to start slow. Make it fun. Ease your child into it. We're not going to go from eating crackers to steak today. So we're going to take that cracker, and something I love using, and parents can take a piece of paper and draw this up real quick, is a star chart.
Okay.
So I don't know if you can see that, but
yeah,
I'll just say it's the first time I want somebody to try a cooked carrot. And we're going to have a piece of paper, and I'm going to draw a box on it, and I'm going to write 1 star. We're going to try a 1 bite of carrot. It's going to be the size of a mouse bite. We're not going to do an elephant bite today. We're going to do a mouse bite today, and we're going to get a star for it. And then the carrot is all gone. We can clean it up. We can put it in the all done bowl, and then we get to play a game. Do you want to go outside? Do you want to do bubbles? But start real small. Make it successful, make it fun, give them visual cues that they can, because then kids any age can really respond to seeing that star. They can draw it themselves. They can do it. It could be a sticker. It could be whatever they want it to be.
Awesome. And that's something parents could just put on a piece of paper. They don't have to have anything fancy. It just could be something they utilize at home with anything around them.
Whatever motivates the kids to. Bubbles, coloring after. Yes.
Well, is there anything else that you would like to share that maybe we haven't covered regarding feeding therapy? Anything else you could think of?
No, I think we've talked about it a lot. The biggest thing I want to reiterate, though, is don't pressure them too much. Keep feeding positive. If it's a non-preferred food, keep it far away from them and let them slowly get it closer to their body. You know, we're going to start at arm's length, and then we're going to bring it closer to the face.
Okay, that's great advice. And I think I'm going to use these on my own children as well.
Let me know how it goes.
All right, thank you. Appreciate it so much. Thanks for helping us today.
Happy to help.
So a few takeaways from Adriana were to start slow, ease into meal times, and make eating fun. Start by touching the food, smelling the food, talking about the meal, all the way until they take their first bite. And remember that not all occupational therapists or speech therapists have been trained specifically in feeding therapy. So when you're searching for someone to help you, make sure they have that specific training. All right. Check out Adriana's website as foodisfuntherapy.com. This has been SpEd Advisors. I hope you enjoyed this session today on feeding therapy. Be sure to check us out at SpEdadvisors.com. Like and share us on Facebook, Instagram, and YouTube. And go ahead and sign in and provide your opinion for those service providers that you're using every day for your family member. Remember, it is a second opinion so that another family, when they're trying to make an informed decision, that they would have your opinion to help them, because it matters. You're a valuable player here, and we just value your opinion. So do those family members. Have a great day, and until next time, I'll see you later.